I'm Dr. Alfred Forrester. I'm a psychiatrist and the medical director here at the Maryland Addiction Recovery Center.
I'm Dr. Douglas Woodruff. I'm the staff psychiatrist here at Maryland Addiction Recovery Center.
My name is LaShonda Roberts. I'm the nurse practitioner here at MARC.
And my name is Colleen Waterfield. I'm the medical services coordinator here at MARC.
The first important comment about the medical department here at MARC is that we work in a dynamic team approach with the clinical staff and the recovery support staff. In some facilities, there is one doctor who is on site relatively infrequently to provide clinical oversight, or there is a medical department that operates independently to just handle medical or psychiatric issues. Here at MARC, we understand that addiction is a complex condition, so all members of the team need to work together to provide the best patient care and treatment experience. Dr. Woodruff and I are intimately involved in each case, attending daily rounds with the clinical team, coordinating care with the primary therapists, and staying informed of any issues a patient is experiencing at both the clinical and the community living campuses. Our primary objectives are to correctly identify any psychiatric issues and to ensure that patients are receiving up-to-date, evidence-based treatment modalities, and that the psychiatric and medical care is collaborating with the clinical staff to facilitate the patient's recovery process. One of the biggest advantages that MARC offers compared to some other programs is time. The length of stay of our program allows us to carefully diagnose and appropriately manage the complexities of patients presenting with co-occurring disorders. We also are able to support any ongoing medication-assisted treatment issues and prescribe appropriate medications on a case-by-case basis with an individualized treatment plan and medication titration protocol.
Many patients come to MARC not only suffering from addiction or substance use disorder, but also with multiple types of co-occurring psychiatric disorders, including trauma, anxiety, depression, unipolar or bipolar, and other psychiatric conditions. Through therapy and appropriate medications, we make sure that these issues are addressed and treated, while also ensuring patients are receiving care for their substance use disorder. These approaches need to be working hand in hand so that the clinical and medical departments take a cohesive, unified approach to the care of each patient, as well as having ongoing clinical consultations during a patient's entire treatment experience.
As the nurse practitioner here at MARC, my primary role is to offer whatever medical support and oversight is needed for a patient during their stay in treatment. I perform history and physical examinations for every new patient who attends MARC programming, whether they are in extended care, PHP, or IOP. I also provide primary and acute care services to patients while they are receiving treatment at MARC. We want to make sure that when a patient is at MARC and under our care, we are certainly treating the addiction and the mental health issues they are experiencing, but also help them begin a journey of overall health and wellness. We want them to begin to take preventative health steps in their lives and make sure they are appropriately managing any health issues they may have.
As the medical services coordinator here at MARC, I work with the patients to schedule any internal and external appointments. I make sure that patients are scheduled to see Dr. Forrester and Dr. Woodruff as well as LaShonda regularly, but I also schedule and coordinate any external medical or dental appointments, such as if a patient regularly has medical issues and needs to see a specialist, a patient needs a dental appointment, or an issue arises and we need to coordinate care or medical records with an outside medical provider or healthcare system. I also coordinate information related to lab tests and results and make sure that Dr. Forrester, Dr. Woodruff, LaShonda, as well as the therapists on the clinical and the recovery support staff are aware of any pertinent information. This type of inter-organizational communication and interagency collaboration is key in order to deliver the patients the highest quality of care.